Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to give you some test taking strategies that you can use for college or even nursing school. And in a previous video I covered some ways you can prepare for your exam, and we also have a whole playlist on nursing school study tips. You may want to check that out, but let's get started with some of these strategies. Number one, you always want to make sure that you can actually write on your test, because some teachers are really picky about that, but it's important to do that. And if you can't, you want to use a scrap sheet of paper, because that's how you can use the process of elimination. It's also how you can keep track of which questions you were unsure about or which questions you had to take a guess on. So when it comes time to review, you can go back and you can check those out. Number two, always write your name on the test or scantron or whatever your teacher tells you to do. And I know that's a no-brainer, but it's really important. Number three, always read the instructions on the exam carefully. And I had a teacher when I was in high school tell us that once we got to college, tests can be a little tougher, a little bit more critical thinking, and you really have to pay attention and learn to read the instructions and read the questions. And one day he gave us a surprise exam, and we sat down and he gave us the exam. He said, you know, this isn't going to count for a grade, but I want you to complete this, and whoever gets it done first will get a prize. So he gave us the exam, and you know, it said to put your name on and to read every question on the exam before you begin. So I put my name on the exam and I jumped down to question one. I read the question, and it said it was a math problem, and so I jerked out my calculator and I marked some questions. Then the next question, it said put an X beside your name. So I went back up and I thought it was weird, but I put an X beside my name. And then number three, it said to clap your hands 3 times. So now I'm like, okay, I've never seen a test like this before in my life. So I clap my hands 3 times, and other people start doing it and everyone's kind of laughing. Then a couple people go and turn their test in, and I'm like, what in the world? I'm only on question 3. I have a whole test here, and these people are turning theirs in. And then I get through and I'm trying to go faster and faster, and then finally I get to the last question on the back, and it says, do not complete any questions on this exam. Write your name on the exam and turn it in. And then it kind of dawned on me that the instructions said read every single question on the exam before you complete the exam. So if I'd actually took time to read every question before I began, then I would see that you don't actually have to take the exam. But you always want to read those instructions carefully. Number 4, always pay attention to those qualifying statements that can throw people off. So for example, one that really messes people up is it'll say choose the best answer. And see, what happens is people go down to A and they see the A is correct and they'll mark A on their sheet, but that's actually not the best answer, because B is also correct, but it's a better answer. So always look out for the best answer. Another one that throws people off is it'll say which of the following is incorrect, or all of the following are correct except. And see, that throws people off, because then they go and they're looking for a correct answer, they see it, they mark it, when in fact it's asking for the incorrect option of all those. So always watch out for those qualifying statements. Number 5, always mark the answers clearly on the exam. So if you have a scantron sheet, make sure you're using like a number 2 pencil or whatever it is they say, and mark the answers really clearly, erase any stray marks and all that. Number 6, always keep an eye on the time, and that's why it's really important to wear a wristwatch during tests. And you can do this different ways. Some people, for example, if you have a 60-minute time frame and the exam has 30 questions, they'll kind of calculate, okay, I need to spend about 2 minutes per question. Another strategy that I would sometimes use is I would kind of divide it into quarters or halves. So for example, let's say you have a time limit of 60 minutes for an exam, and the exam is 100 questions. Well, after about 15 minutes, that's a quarter of the way through my time limit, I would know I needed to be roughly on about question 25. Or after 30 minutes, that's half of my time limit, I know I needed to be somewhere around question 50. So kind of keep track of your time in some way like that. Number 7, always eliminate the wrong answers first, and then use a system to keep track of which questions you had an educated guess on and which questions you were absolutely clueless about. And this is how I would do it. Basically, when I came to a multiple choice question, if I knew the answer, I would put nothing. If it was an educated guess, like I could eliminate A and C and it was between B and D or something like that, but I knew it was between 2, I would usually put a slash beside that question. And that told me this is an educated guess. I know that it's a 50-50 chance, but I need to come back and review it if I have time. Now, if I had no clue and it was a complete guess, I would usually either put a question mark or an X beside it. That way I had a system where I could prioritize when it came time to review, and I would always go for the ones that I had no clue about first, because that's the higher risk of getting it wrong. Then I would go and review the ones where I had a 50-50 chance. So you're always limited on your review time, so that helps you prioritize it. Number 8, trust your gut. If you come to a question and you're not sure about it, but you feel pulled in a certain direction, just go with that, because a lot of times you will actually overanalyze and overthink a question and you'll go with the wrong answer because you're just playing it up too much in your head. So watch out for that. Number 9, don't forget that you can always ask the professor for clarification. And this happened to me one time when I was taking an anatomy and physiology test. I took the same class with my wife, and I came to a question about axons and dendrites, and it was talking about which way the impulse was going in the nerve cell, but it was worded in a really weird way, and I knew the answer, but I just didn't know the way the test was actually wording it. So I went up to the professor, asked her to rephrase the question. She did, and then I immediately knew it and I got it right. So don't forget to ask for clarification. Number 10, you always want to review your exams, and I would be the last one out of the classroom, because after I completed the exam, I would use every second of time I had to review. And this is so important. So many times this has helped me push my grade higher, because a lot of times you'll get through the exam and some of those questions will spark memories, and then when you go back and you look at some of these that you had to take a guess on, hey, guess what? Now you know the answer and you can correct that. You can also look to see if you made any mistakes or maybe you misread a question. So I would always spend every second I had to review. Now, a few other tips. Whenever you're in doubt on a multiple choice test, B tends to be a more correct answer than others, statistically speaking. So if you have no clue whatsoever, you may want to go with B. Next, if it's a multiple choice question and it has a question that you're unsure about and it has the option of all the above or none of the above, then usually those are correct if it has one or the other. Now, a lot of tests in college now will have like all the above and none of the above for every single question, so it doesn't work in those cases. But if it's just a random all the above or none of the above and it has one of those options, then usually that's going to be the more correct answer. And then finally, just to kind of expand on this point that I mentioned earlier, you always want to look for questions that reveal or give hints about other questions on the exam. And this can be a huge way that you can bump up your score and correct a couple things. And I'll show you right now real quickly how I would do that. Okay, now to give you a quick illustration of how you use the process of elimination, and also how some questions can actually tip you off and give you the correct answer to other questions where you had to take a guess. Let me show you how that works. Okay, so let's say question number 7 on an anatomy and physiology test asks this: all of the following are bones found in the middle ear except. Okay, what it's asking is, it has that qualifying statement, except. It's saying that all of these are going to be bones found in the middle ear, but one of them is wrong. That's what it's asking. Which one is the wrong one? Which is not found in the middle ear as a bone? So first of all, we have stapes. And let's say you use a process of elimination. You say, okay, I know stapes is a bone in the middle ear, so I'm going to mark that out because it's asking for which one is not a bone in the middle ear. Next, you have incus, and you're like, not sure about that one. Then you have the malleus, and you say, okay, I know that one, so I'm going to mark that one out. So you're left with incus and pinna, and it's asking which one is not a bone in the middle ear. And you're not sure, okay? So let's say incus kind of sounds like it's probably a bone in the middle ear. That's what your gut's leaning towards, but you're not exactly sure. But you're going to say, okay, I want to think that this is the one that is in the middle ear. So what I'm going to do is I'm going to mark pinna. I don't think that one's in the middle ear. I don't think it's a middle ear bone. That's the one I'm going to mark, and you go ahead because you had to take a guess, and I would usually make a slash beside it like that. That told me I need to review this. It was an educated guess. So we keep going through our exam, and let's say we get down to question 25, and then this question says this: all of the following are found on the outer ear, which is the pinna, it has in parentheses, except. Aha! Now we have a clue in the other answer that can help us in the other question, because it's saying that all of these are found in the outer ear, and then it defines the outer ear by calling it the pinna. So now we go back to this one, and we know that pinna is the outer part of the ear, therefore it is not a middle ear bone, and we had that correct. And usually I would just mark off the line that told me I need to review it. So those are some tips on some test taking strategies. I hope that helps you. Again, we have a whole playlist on nursing school study tips. Thanks for watching, and please consider subscribing.